Alrighty. I'm going to enter my patient's here. I'm going to use hand hygiene. I'm going to set this patient up for seizure precautions because this patient was admitted with seizures, or if a patient has a history of seizures, then we want to go put precautions in place to prevent any injury. So I'm putting on my regular gloves. One of the first things I can do is pad the rails. Let's see, let's put this one here against this side rail, and I'm going to put this pillow so I don't reach across the patient. Is use this pillow against this side rail. Some facilities may have you use blankets. You can use either. Suction is already set up in here. We just went over that with our aspiration, and we have suction available. But if the patient is currently having an actual seizure, we put nothing in their mouth. So you will not use this during a seizure. It can just be used for oral secretions either before or after. I have two different kinds of oxygen devices here. So we want to have oxygen available for the patient just because there is risk for low oxygen during the seizure or after. So I have my oxygen monitor here on the wall. Oxygen is always green. This one is called a non-rebreather mask. So I'm going to attach it to the bottom. And then I can dial what they need by turning this. The mask is going to go fit around the nose and the mouth by this green strap here. And then this bag will fill up with the oxygen. The patient is receiving more oxygen than what a regular nasal cannula would give them. So I'm going to remove this. We would just have this available for the patient if need be. Okay, so I have another oxygen device here called a nasal cannula. This has two little prongs that's going to provide patient oxygen in their nose. I'm going to go ahead and connect to the oxygen monitor here, regulator. So with the cannula, it looks like it has like a loop. This is going to go in front of the patient. I'm going to move this pillow just for a second. And there's two prongs here, and they kind of curve and go up. This is going to go in the patient's nose. So I'm going to slide those right in each nostril. I'm going to put one loop around the one ear and one loop around the other ear until it is in and secured in the front, never around the patient's head. So then there's a little slide here that I can bring up and make it secure for the patient so it's not falling off. And then I'm going to go ahead and still monitor the patient, round on them frequently. I want to prevent them from falling or having an injury due to a seizure, so I want to make sure that their call light is in reach, and then they can call me if they feel like they're getting that aura, like they feel like they might be having a seizure. When I'm finished, I make sure the bed is low and locked, that their personal belongings are in and call light are in reach. Take my gloves off and use my hand hygiene before I leave the room.